This is our IUSS machine, which is our immediate use steam sterilizer. This is number 2. It lives in the sterile core outside OR8. I had to consider using it today because my one-of-a-kind straight Mayo scissor is contaminated. It doesn't have any soiled organic material on it. We just discovered that it didn't have a sterile indicator. We need this for our surgery today. So we discussed with our surgeon and they agreed, you know what, you should flash that. We can't wait. We need this instrument now to perform our surgery on a patient that has a spinal and it's gonna start to wear off. So I've come out here to our IUSS flash machine. We've got the binder here on the side that has the policy listed in the front. If you need to review, it has the steps included. I'll pull that out now for a quick reminder. This machine is checked daily by the MDRD staff downstairs, and they put the printouts with the confirmed integrator that was accepted to document all the tests that they do on a daily basis. And then when we need to use it as nurses, we're gonna come get the binder, access the policy if you need it, can flip to the back, and we're going to complete this after. But this is the logbook that documents what patient had it done on what date, ordered by what surgeon. So we'll take a peek at that after. But right now, I just want to refamiliarize myself. So here, we've got our oven mitts on the side, instrument pans and lifters as well. I'll show those as we go along. Chemical integrators, and the logbook. So we just want to remind you guys that the flash sterilizer is only used for situations where there is an urgent, unplanned need with no other option available. It is not for use to sterilize any implants, to sterilize complete sets or trays. We do not do that. We don't want to compensate for inventory shortages or scheduling problems, and we will never sterilize organic material like a cranial bone flap. Okay, so moving along here, like I mentioned, this item does not have any organic material on it. If it did, I would ideally send it downstairs to MDRD in a plastic bag, ask them to decontaminate it and wash it up, lickety split, and then send it back up to us. And then we would place the item with a chemical integrator in the appropriate instrument pan. Place the instrument pan in the autoclave and select the appropriate amount of time to sterilize. So you can do 4 minutes for a single instrument with no lumens. That would constitute this single item here. I would put it into the pan with the hinge open to allow the steam to sterilize all of it. And we could select the 10-minute cycle if we had 2 or more instruments, or if the instruments had a lumen in it. So I'm gonna set this aside. We're gonna open up the machine here by pressing on the pedal down below in case you didn't know. We're gonna open this big door. And what do you know? I have one perfectly nice little pan. There are other pans available. Sometimes you need a bigger pan. You can always call MDRD to get you the size that you need. There are other ones available here, but I have removed them because I don't want any extra items in the machine when I'm going to use it. So I've got the one in there that I want. I'll keep the hinges open. I placed it in there. On the side here, we have some chemical integrator strips. They don't expire till 2025. I'm going to take one, place it in there, and close the door by pushing the white button up here. Okay, so now I want to do 4 minutes to start the cycle. Select your flash time and press start. Easy peasy. So that's gonna run for 4 minutes now. We're gonna pause the video. Okay, the autoclave cycle is now complete. It was beeping very loudly to notify me that it was complete. So the first thing you wanna do is check the parameters on the printout before opening the door. So we're gonna rip this guy off and we're gonna double check it to what is listed up here. So you wanna make sure that the cycle run time was complete at 4 or 10 minutes. I selected 4, and that the temperature was over 273 degrees Fahrenheit. And I can see that it was here at 273.5. that the pressure was over 28 PSI, which it was at 33.5. And then I can open the door. So I'm happy that the parameters were met with this printout. We will keep this to document in the logbook for after. And now I'm gonna open the door again using my foot. And it's gonna be very hot. I turned it off. Okay, so we're opening the door. And feel that heat. Now this is when we have to do some consideration based on the size of the instrument, what you have to carry it. You probably, and maybe need to get your scrub nurse out back here. Even though we know we don't like to do that, we also don't like to use the flash sterilizer. So we're going to use as much considerations as we can to maintain asepsis and sterility throughout this. I can visualize that the sterile indicator was met, that the integration has passed through that indicator. Your scrub nurse or the circulator is going to want to confirm that. This is a nice little instrument that's not heavy. I can use this instrument pan carrier to carry this out, but it is a little wonky and uneven, so you want to be careful because you don't want to drop that. So an alternative would be to have the scrub nurse come out back using a sterile green towel. I could also consider using another instrument of sorts. We have the oven mitts hanging on the side, but you do not really want to carry your sterilized instrument with these old, dirty oven mitts.
Are you super busy right now?
I'm filming a video.
Oh, sorry.
Yeah, I'm not super busy, but we'll just be done in a second. Okay, so now as a scrub nurse, I'm gonna come in with my sterile towel. I'm gonna lift the pan out. I could carry this to my room. I could place it into a basin full of saline or cold water. I could use my forceps to take it out, either or. I see the integrator, the chemical integrator was met. We're gonna go to the room like this. Our circulating nurse is gonna document in the logbook and take this integrator and the printout with a patient identifier sticker, and you're going to attach that in the back logbook here. Okay, so you're going to fill out the surgeon's name, if the parameters were met, if the chemical integrator passed, the circulating nurse's name, the equipment, the date, and then you're going to complete your incident report on expanse. Thank you so much. Bye.